In the first part of the course, we are looking into the elements and mechanisms of ritual, how rituals are put together and how they operate. We already looked at symbols and talked about the importance of symbolic action. Ritual is a unique aspect of human experience in large part because it is performed with the body. We talked about how these embodied experiences can affect people's sense of themselves, others, and their commitments. Let's take this a step further. Can ritual experiences affect our physical bodies and our state of health? Myriad cultural systems across the world incorporate ritual activities within their practices of healing and wellness. Why? Are they effective in some way? In this unit, we are going to address these questions through examples from the United States, Bolivia, Brazil, and yoga as it is practiced in various parts of the world. We'll see that, not surprisingly, these ritual practices are structured in very different ways and have diverse effects. In this unit, we'll want to think about the relationships between mind and body. So let's first touch on imagery and dig deeper into the concept of embodiment. We've seen that ritual is a deeply complex human activity involving bodily movement, the manipulation of symbols, and all of our senses. One important element of ritual, though, is one that cannot be seen, and that is mental imagery. Very often in ritual, through a process of guided imagery, participants are guided by way of chants and songs to envision certain things and to place themselves within that imagery. In healing ceremonies, such as those conducted by traditional healers known as shamans, patients may be talked through images of themselves being healed by spiritual forces. For example, Robert Desjalais described this type of healing practice among shamans in Nepal. He describes how these shamans utilize imagery about movement through what he calls a healing geography, or an imaginary landscape, to move the patient from an experience or a feeling of sickness to one of wellness. As the patient lies before him, the shaman, through chants and songs, describes a mystical landscape and describes himself as magically moving through this landscape in order to diagnose and resolve the patient's problem. For example, the shaman may discover that the patient's illness was caused by his soul having been dragged into the waters of forgetfulness, or being trapped inside a castle, or having been attacked by an ancestor ghost at the crossroads, or being lost inside the jungle where many malevolent spirits dwell. Then the shaman describes himself moving through the imagined landscape to, for example, go up the inner mountain snowfields and receive a vision, or to call upon the goddesses of rocks, valleys, soils, and rivers to see if the soul has been trapped there, to find and rescue the lost soul, to release the soul from the fortress, to walk down the right mountain path, to climb the ladder through the 7 celestial realms, etc. As he describes his magical flight, the shaman is conjuring up images within the mind of the patient. The patient's focus moves from images of sickness to images of healing. There are commonalities between the shaman's work and the psychotherapist's work, as psychotherapists similarly diagnose the psychological landscape of the patient using words such as traps, snares, and pitfalls, and they use metaphor and imagery to work through and beyond those obstacles. In the end, the Nepalese patient who believes in the shaman and believes that the shaman properly guided them through the healing geography will feel that they are on the road to recovery, metaphor intended. Guided imagery has also been adopted and elaborated by a new set of healers in the United States and elsewhere who did not grow up with these shamanic practices. Let's circle back to embodiment, which refers to bodily movement and experiences felt through the body. Embodiment is a defining element of all rituals and what makes ritual so special among the different elements of social and cultural life. Ritual always involves the orchestrated movement of bodies. Things such as standing, sitting, kneeling, turning around, holding things aloft, marching, lying prostrate, washing, wearing special clothes, bowing, dancing, going into trance. These are common embodied experiences in ritual. Rituals involve all of the senses, which include the 5 senses that we commonly talk about in the U.S.: sight, hearing, smell, taste, and touch, but also other senses, including the sense of balance, vestibular sense, the feeling of one's body in space, proprioception, the feeling of pain, nociception, and the sense of temperature, thermoception. We want to consider how the various bodily movements and sensations in ritual affect the minds, moods, beliefs, and perspectives of the ritual participants. One question we might ask ourselves throughout this unit is, how much does ritual depend upon imagery as compared with embodiment? Or is it possible that different rituals work in different ways, some placing more emphasis on imagery and others privileging embodiment? Or, in fact, do some rituals entail coordination of imagery and movement, perhaps requiring people to focus on certain images while simultaneously moving their bodies into those same shapes? As you're reading these articles and watching the film, think about what is really happening in these rituals. What are people doing? What are they saying? According to the anthropologists describing them, what effects are achieved? How do these ritual practices of healing fit into the larger social, cultural, and even political context? You'll read first about the ritualized birthing practices of midwives in the United States. You'll see that the midwives don't orchestrate one single big ritual. Rather, according to Melissa Cheney, their practices of wellness involve ritualization throughout the period of pregnancy, birth, and the postpartum period. What ideas about the body, pregnancy, womanhood, families, connection, and health are communicated through these practices? Then we'll head to Bolivia and read about native Aymara ways of talking about and treating what has often been translated as soul loss, and how and why these practices mirror those of indigenous activists. While we sometimes talk about cultural healing practices as if they were an unchanging system, the author, Anders Berman, raises the important question about whether health practices are linked to, and therefore both affect and are affected by, larger political developments. If that is true, do people, in a sense, need healing rituals that help heal their political selves as well as their bodies? Then you will watch the film Planet Yoga. The filmmaker interviews a series of yoga instructors, religious historians, and gurus in Canada, France, and also in India, the birthplace of yoga. As yoga is spreading around the world, you will see that there are varieties of yoga practices, and some practitioners place greater emphasis on the spiritual elements of yoga, while others emphasize yoga as a practice of well-being. As you're watching the film, return to our question of imagery versus embodiment. Yoga obviously stresses bodily movement, but does imagery play an important role? To answer this question, you will need to play detective. The narrator doesn't make this explicit, so you will need to interpret the scenes on the screen. Are yoga practitioners enjoined to imagine certain things while they are moving their bodies, perhaps moving their bodies into the shapes that they are imagining? Finally, we'll head to Brazil and examine healing practices in temples in 2 closely related religions, Candomblé and Umbanda, both of which emerged out of the African traditions brought to the Portuguese colony of Brazil by enslaved Africans. You'll see that the author Vink and Marcus emphasizes how the conversation dramatically unfolds between the patient, the spirit medium, and the good and bad spirits that can cause and heal illness. How are these practices similar to and different from Western psychiatry? As you consider the healing rituals in these 4 cases, place them in comparison with one another. Is there something common to all of them? In other words, is there some central essence of ritual healing? Or are the experiences so diverse that each needs to be understood on its own terms? I look forward to reading your ideas in the discussion.